right, good morning everybody and welcome to our February Facebook Live event. Today we're going to be talking about heart health in honor of February being Heart Health Month. So I'm Kim, I'm a physician assistant here at Grace Health. I've been working in the B3 neighborhood for about the last 2 years as a family practice provider. And I have with me today Kari, who is a community health worker and a resource specialist. So I'll let her introduce herself a little bit more as well.
Yeah. Hi there. Yes, so I have been with Grace Health for a little over 3 years, and mainly my role is offering resources to our patients.
Awesome.
Yeah.
So we're going to start off just with some fun facts while we have some time for people to join in. So your heart actually beats about 115,000 times every single day, which amounts to about 2,000 gallons of blood every day for the average person. So it's moving a lot of blood. It's obviously a very important organ, and we'll talk a lot more about that today. And then another fun fact I found is that if you stretch out your blood vessel system, it actually extends over 60,000 miles, which is the equivalent of about 3 trips to Australia and back. So it's kind of crazy to think that all of that is just packed right within your body, among many other things. So we're going to have a little bit of a conversation today, talking obviously about heart health. We'll talk about some barriers to heart health, because we know that is definitely something all of us face at different times and in different ways. And then some suggestions for how to overcome some of those so that we can all get to living healthier lives and lives that are better for our hearts. So we're first going to start off talking about what heart health is, kind of a big picture view. So it's obviously a very, very broad topic. So it can include things like heart attacks, heart failure, arrhythmias, including atrial fibrillation, but it also includes things like peripheral vascular disease, peripheral arterial disease, and there's obviously a lot of things that play into these big diseases that we mentioned as well. So that can include high blood pressure, high cholesterol, diabetes, sleep apnea, alcohol use, tobacco use, a sedentary lifestyle. There's a lot that plays into heart health, a lot of factors that either improve our heart health or put us at risk for heart complications. And so we'll kind of break these down one by one to make them feel a little bit less overwhelming today. One thing that we want to keep at the forefront of this presentation too is that if we do things to take care of our heart, the nice thing is that it will help take care of the rest of our body. So things that are going to improve our heart health will also improve, gut health. They'll reduce our risk for cancers. They'll help our brain stay healthier, both from a mental health standpoint and from a stroke prevention standpoint. So while it can feel overwhelming to talk about all of these things today, the nice thing is that it does more than just help our heart. It really helps our whole entire body. So I wanted to jump in first and just talk a little bit why heart health is important to each of us and why we felt compelled to be here today talking about this with you. So Kari, if you want to tell us a little bit more.
Yeah, so I have quite a family history of heart health, cardiovascular disease actually. It goes all the way back to my great-grandpa. He passed from a massive heart attack, and then my grandpa at a pretty young age had his first heart attack, and then my mom had what's called the widowmaker heart attack at age 52, and that's scary. That's really scary. She is alive and well, and but it's I think just a real eye-opener on, like, okay, I need to be mindful and really take care of myself and bring in healthy food into my lifestyle and exercise and all of that. So I would say from a pretty young age I have been mindful and aware of how I care for my body, just to keep my heart healthy.
Yeah, absolutely.
Yeah.
And I actually, have a similar situation. I have a very strong family history of cardiovascular disease as well. My grandfather and my father both had heart attacks at young ages too. So I think that has also pushed me to care a little bit more when you see it played out personally in your life. So yeah, and then we know, beyond just our personal stories, we do know that, cardiovascular disease is actually the leading cause of death worldwide. So we're far from the only ones affected by it. I think, if you asked anybody, and most of you probably listening can think of somebody who's been affected by heart disease, even if it's not you personally. So, like we had said, the heart is very important to sustaining life, obviously, and taking care of it really helps take care of everything else for our bodies. And I always like to stress too, heart health is not just about avoiding a heart attack or avoiding heart failure. It's really so much more than that. Because if we can take care of our heart and take care of our body, we're going to live healthier and fuller lives. We're going to be able to be more active, do things that we want to do, be present for our friends and family in a better way. And so it's not just avoiding that end point of death, it's also making sure that we stay healthier through the duration of our lives so that we can enjoy it to its fullest. And like we had kind of already touched on, heart health is really for everyone. So even if you don't have a family history, even if you don't have risk factors yourself, it is never too early to start reducing your risk, to start improving your health. And even if, that's not something that's quite as important to you, like I said, almost everyone probably has friends or family who are impacted by heart disease in some way. And so, hopefully learning some of these things today will equip you with more knowledge and tools to be a good support system to them and to help encourage them in their heart health and in their goals. So now that we've talked a little bit as an introduction about what heart health includes, why it's important to us personally, I want to kind of, like I said, break this down into smaller pieces and talk about 7 different major risk factors for cardiovascular disease and how we can reduce our risk through addressing these things.
So the question would be, how can I reduce my personal risk of heart disease?
Yeah, so something that I love about heart disease is that it is very modifiable. So what that means is that, yes, there is that genetic role that can be a component of this, which obviously we can't change that. But beyond genetics, we have an incredible amount of power and agency to be able to change our outcomes and our risk pertaining to heart disease. So the American Heart Association kind of breaks down heart disease into these 7 categories, which I'll go through in order, and we'll kind of spend a little bit of time focusing on each one. So the first one is weight control. So the goal is to get to a healthy BMI, which would be less than 25. Now this one, I don't personally, as a provider, love to focus on weight in and of itself. And the reason is because we can't will ourselves to change our weight. We can't necessarily control that in and of itself. And it can be really frustrating to focus on weight alone. Right, so instead I like to kind of shift the focus and say, hey, let's just focus on things that we can control. And when we're talking about weight, that's going to be more pertaining to diet and exercise. Now, obviously, as with anything else, there's also a genetic component to this too, so I'm not neglecting that. But it's helpful to not focus on the numbers and just focus on what we're doing and what changes we're making and we can continue to make to help with this. So I know I've talked to many patients and scales can be frustrating and focusing on a certain weight goal can be very, very frustrating. So with weight, generally my recommendation for people is to not measure your success by the number on the scale. Is it something we use to stratify your risk and pay attention to? Yes. But I think from a mental health standpoint and from a success standpoint, it's really not that helpful for a lot of people. So my recommendation is always to measure your success if you're on a weight loss journey by, at the end of each day, asking yourself, did I move? Did I get exercise? Did I do a little bit more activity than I did the day before? Did I hit my 30-minute goal or whatever your goal might be? And then did I make healthier food choices? Eating less processed food, less sugars, things that are going to be better for my body and healthier for my body. And I think that's just a better marker of success and allows you kind of that positive feedback as well. So instead of, I'm working so hard and I'm dieting and I'm exercising and, I'm only down a pound or I didn't lose any weight. Well, look back at your day. Did you make good choices for your body? Did you do good things for your body? If you did, that's super important, because even if that number on the scale doesn't change, you're still reducing your risk factors. So kind of jumping in to break that down a little bit more, the second of the 7 things that we can control and help reduce our risk with is going to be regular exercise. So I like to start with just talking about what a goal is. So again, the American Heart Association recommends shooting for about 150 minutes of exercise a week. So if you break that down, that's 5 days a week doing 30 minutes of moderate intensity activity. So that's going to be something like a fast walk, biking, mowing your lawn, things like that. My gauge for that is usually where if you're doing something and you feel like it'd be hard for you to complete a full sentence talking to somebody, that means you're doing moderate intensity activity. So you want to get 150 minutes of that a week. They also recommend trying to get at least 2 days of that as strength training, so a little bit of weights or weight-bearing activity. And then, you may have heard the phrase, sitting is the new smoking, and I think we're all kind of guilty of that. But they recommend breaking up any prolonged periods of sitting with some activity. So, if you're at work or elsewhere and you have more of a sedentary or sit-down job, trying at least, once an hour or so to get up and take a lap, or, if you're able to, do a few air squats or push-ups or whatever works in your context. But that can be really, really helpful too, to just keep your heart moving, keep that blood flowing, and keep those blood vessels healthy. So with exercise, the biggest thing is going to be progression of your exercise. So, if you're not somebody who typically works out or gets much activity, you may hear me say 150 minutes a week and go, well, that's not going to happen. That's just unrealistic. I can't do that. And that's okay. We all have to start somewhere. And I think we've all been in periods of time where 150 minutes a week would be very difficult for us. So the key is just to start where you can. So it's not, hey, I can't do 30 minutes a day, I might as well just not do it. No, even if you can get 5 minutes in, start with that. Your body will adapt. It's an incredible thing. It will adapt. And with time, you'll be able to progress up to that 30 minutes or sometimes even beyond that. And so the key is just to start where you are, to give yourself grace, to not get, beat yourself down if you can't reach that definitive goal, to start with your own goals, and then week by week, day after day, just work on improving on that. And you will get there with time, definitely. So moving on to the third component. And I apologize. I meant to mention prior, we do have a comment section open. So if you guys are watching and have any comments while we're talking, please just throw a comment in there, a question in there, and we'll try to address that as we go. We will also open up for some questions and comments at the end of the presentation as well. Okay. So third component is your diet. So working towards a healthy diet. So in the last 5 or 6 years, there's been actually a fair amount of new research on this, with kind of the plant-based diets and the vegan diets becoming more popular. As far as statistics on a plant-based diet, so that's going to be, whole food plant-based, eating only things that come from the earth. So it's a very, very strict diet, one that probably doesn't work for most people practically. But I wanted to talk about it just because it really can do some incredible things for your heart, and there's still a lot of new research coming out about it. It's not a diet that's been very popular for long, so we don't really have a lot of long-term data. But we do know that with that diet in the short term, it can reduce the risk of death from heart disease by about 40%. So that is huge. And then it can actually also partially open blocked arteries in up to 91% of patients, according to one of the studies put out recently. And actually, interestingly, we really don't have any medications that can even do that. So we'll talk a little bit more about medications at the end of the presentation, but it is pretty incredible. Dietary changes definitely have a huge impact. A plant-based diet can reduce your risk of high blood pressure by about 34%. And then it was also associated with about a 29-point decrease on total cholesterol and a 23-point decrease in LDL, which is your bad cholesterol, in patients compared with people who had kind of eaten regular American or non-vegan diets. It's also associated with weight loss in most people who do it. So, again, I understand plant-based diet is not going to be achievable for most people. I can attest, I did it for about 3 months and then kind of fell off the train. It's a lot of work. It's not always the tastiest food. They can be very, very good, but especially when a lot of our diets are kind of more of the typical American diet, a lot more processed food, that sort of thing. It can be a big jump to go completely plant-based. But the reason I give these statistics is just because, again, to kind of showcase how potent and how effective this can be. And then also, there is still a lot of data to say, okay, even if we don't go vegetarian or vegan, if we just increase the amount of plant-based foods that we're eating, so fruits, vegetables, whole grains, and reduce the amount of processed food that we're eating, so that's going to be anything that comes from a box, a package, a can, that sort of thing, that can have significant effects on all of these measures that I mentioned earlier. So the point of that is that even if you can't, again, just like the exercise, even if you say that's an unrealistic goal for me, that's okay. It's not going to be realistic for most people. But the moral of the story is that, if we can just start where you are and start making some positive change, it's going to have an impact and it's going to change your outcomes and your heart health. So again, the best thing that you can start doing is to take a look at what your diet is right now and look to reduce the amount of processed foods that you're taking in. So again, anything from a box, a package, a can, those are going to have a lot of extra fats, a lot of extra salt that's going to bring your blood pressure up. Lots of times a lot of extra sugar as well, and they're harder for your body to process. They also contain a lot of cholesterol, which can build up in your arteries. And I usually do recommend for people to start with your drinks, then move on to your food. So if you're taking a lot of, sweetened coffees or sweetened drinks, that sort of thing, that can be a good place to start. That's going to have a big impact on your health. And then from there, to kind of fill that void from those processed foods, I like to encourage people to work in more vegetables and some fruits as well. So a good kind of visual to use is if you take your plate at any given meal and kind of cut it in half, try to get half of your plate as fruits and vegetables. And then in the other half, you cut that into quarters and try to make a quarter that good lean protein. So your chicken, fish, beans if you like beans, tofu, nuts, that sort of thing. And then trying to leave that last quarter as your carbohydrates. And again, especially for heart health, making those carbohydrates more whole grains. So, oatmeal, bran cereals, that sort of thing, whole grain breads, whole grain noodles, those can be more helpful for you. Okay. And just so that you guys know as well, if you have more interest, this is kind of surface level on the dietary piece, but next month we will be having our dietitian Kirby and some of our healthy lifestyle coaches doing another presentation just like this to kind of talk a little bit more about food options and food choices and how that can be helpful for your overall health. So be sure you check into that. Okay, so moving on to number 4, and that's going to be smoking cessation. So if you are somebody who smokes, quitting tobacco use is actually the most important thing that you can do for your health. It can really help in all aspects, and so it's something that is important to note here. So I wanted to kind of show you guys, and this may be a little bit hard to see, but this is kind of an illustration of your blood vessels. So starting over here is kind of a healthy blood vessel. You can see, maybe you can see, it's wide open. There's nothing inside of it, so your blood can flow through here really, really easily. Now you can kind of see through here the progression as the artery fills up, and then here all the way on the other side, you can see this artery is almost completely closed off. So this is just an illustration of what happens in your blood vessels that increases your risk for these heart diseases and for vascular disease as well. So smoking actually creates a lot of irritation and inflammation in this lining, okay? And so what that does is that causes a reaction, and then, in addition to a lot of other things like your cholesterol intake, your fat intake, can make your blood vessels more prone to form these plaques, okay? And these plaques are our issue when we're talking about heart attacks and strokes and that sort of thing. Because as they build up, one of two things can happen. Either they can build up so much that the blood just can't get through anymore, or they can build up enough and then break off and travel to a place where we don't want them, like your brain or your heart. And again, that would be, your heart attack or your stroke. So smoking not only impacts your lungs, it also impacts your blood vessels all throughout your body. And so quitting is very, very important. I do know that it's easier said than done. So the CDC says it actually takes the average person about 8 to 11 tries to quit smoking. I know that can kind of sound discouraging, but I kind of try to flip it the other way and say, hey, if you've tried before to quit smoking and not had success, that doesn't mean, you did something wrong. It doesn't mean that you won't have success in the future. You are definitely not alone in that, and that it takes, about 10 tries for the average person to quit. And we do here at Grace Health have a variety of things that you can do to help you quit smoking if that's something that you're interested in or ready for. We have behavioral health available to help with accountability, or if you know that something like anxiety or depression triggers your smoking, they can definitely help with that. We have, as providers, we can prescribe different things like patches, medications, and provide accountability as well to help you set goals and reach them. And then one other interesting thing that we do have available here is actually acupuncture for smoking cessation. So a lot of people who especially don't want to do medications as much, that can be a good option to consider, and has fairly good efficacy for a lot of people as well. Okay, so moving on, hang with me here, we got 3 more. Moving on, we're going to talk about hypertension, which is our 5th contributor to cardiovascular disease. So hypertension is a very important one to control. We know that can greatly increase your risk for cardiovascular disease. And obviously this is going to be a combination of, oftentimes for people, medications and lifestyle changes. So even if you're asymptomatic with your high blood pressure, it is extremely important to get it under control. I know oftentimes I have people come in and say, hey, I just run high, that sort of thing. And I get that. If you feel well, and especially if you're like myself and don't necessarily love taking medications, it can be easy to kind of think, I'm feeling fine, I'm doing fine, I don't get the big deal. But it is very important to get this under control. We call hypertension the silent killer for a reason, because it's not a problem until it is, and then it's a big stinking hairy deal. So, work with your provider if this is something that you have to help get that under control. The biggest things lifestyle-wise for this are going to be limiting your salt intake. We have something we call the DASH diet that you can look up on Google and follow that, and that can be a significant help with lowering blood pressure. Again, quitting smoking, getting exercise, limiting your alcohol intake as well can definitely help, and caffeine too. And if you're someone who has sleep apnea, that can be really important as well to get that blood pressure under control. Goals, if you have high blood pressure, is to keep that pressure under 140/90 for most people. If you're not hypertensive, a normal blood pressure is going to be around 120/80. Okay? And then another risk factor is going to be diabetes or blood sugars. So I'm not going to go into a lot of detail with this one, and that's because just a couple months ago we had one of our other providers, Miriam, do a Facebook Live just like this on diabetes. So she has a wealth of information there for you guys, and if you just search the Facebook page, you can find that. But the one thing I wanted to highlight, because this is a connection that I think a lot of times isn't made, is that yes, diabetes is a sugar disease. It's an endocrine disorder, but it really also, in functionality, is a vascular disease. So when blood sugar is uncontrolled, it greatly increases risk for heart attack, for blood vessel issues, peripheral arterial disease, all of those things. And it's kind of a similar thing to what we had talked about with the arteries and the smoking, where it increases inflammation and it increases your propensity to build up those plaques. So again, diabetes is also very modifiable. So go ahead and check out Miriam's Facebook Live if you have any other questions or interest in that. So last risk factor is going to be your cholesterol. So typically this is something in a lot of people that will just check yearly unless you have, already known elevated cholesterol or other concerns. So just kind of a breakdown of what your labs might mean if you've seen those before and had questions. So LDL cholesterol is considered your bad cholesterol. HDL cholesterol is considered your good cholesterol. And triglycerides are another measure. Those are actually a little bit more related to carbohydrates than a lot of the other cholesterols. Still related to fat, particularly saturated fat, but carbs play a big role as well. So again, back to the blood vessel model, same thing we had talked about. So part of this plaque is going to be due to that cholesterol. It builds up, it adheres to these walls, it creates occlusion, and then it increases our risk for heart attack and stroke and arterial disease. It can also make your blood vessels a little bit stiffer over time too, which can increase your risk for high blood pressure as well. If you have experienced high cholesterol, you may have had a conversation with your provider about statins. Statins are a drug that kind of sometimes get a bad rap from people, but there is a really good reason that we use these. And there's two main things that they do. Yes, they help get your cholesterol numbers down, which is always good. But more importantly, they help to reduce the buildup of this plaque. So even if your cholesterol is still a little bit high, they're going to prevent this plaque from adhering as much and getting as thick on your blood vessel walls. Additionally, they also help keep this plaque that's already there adhered to the walls. So if you remember what I had mentioned earlier, one of the risks of the plaque in here is that it can rupture or break off and travel, and that's not a good thing for us. And so these statins help prevent it from building up, and when it's already there, they help keep it adhered to that wall so it doesn't move around and cause us problems in the future. So there are really good mortality benefits in the studies, meaning these drugs help people live longer and healthier lives, and so that's the reason that we use them. If you have questions on that or have had high cholesterol, it might be something that's important to talk with your primary care provider about a little bit more. One other medication that we talk about a lot with cholesterol and with heart health is aspirin. So there's kind of been a long time recommendation for people with high risk to take a daily baby aspirin. And those recommendations actually recently just changed according to some of the major guidelines. So now the guideline is if you're 40 to 59 years old with cardiovascular risk, which would be all of those things we had just kind of talked about, then the recommendation is to take just a baby aspirin, so 81 milligrams once a day. And that is obviously as long as you don't have any significant bleeding risk. If you have questions on that, again, it'd be a good thing to talk about with your provider. The recommendation changed in that they no longer kind of recommend these for everyone, or especially for older people. And again, that's just because of that bleeding risk. Now, that is different if you already do have cardiovascular disease, if you've had a heart attack or a stroke or some of these other diseases we've talked about. That is a different scenario. But just for prevention, those guidelines have changed. So I know that is a lot of information. Thank you for hanging with me. We're going to jump into a few other things here with Kari as well. But I just kind of wanted to wrap up this section by saying, it's a lot. It can feel overwhelming, but none of us are going to make changes overnight. None of us are going to be at our goal, maybe even in a year or 2 years or 5 years, and that's okay. What I want you guys to do is to try to pick just 1 or 2 things that we've talked about that you think, I think that would be helpful. I think that sounds doable, and to work on those things and to make some positive change. And then, hey, if you accomplish them, come on back, listen again, and pick some more goals to try to accomplish. We're all works in progress. We're all working on different things. So try not to feel overwhelmed. Try to just focus on a few things that sound tangible to you and work on those. So I want to jump in now to talk about some barriers, because obviously all of this stuff is easier said than done. It's easy to talk about plant-based diet, not so easy to do it. So Kari is here to kind of shed some more light on that, since this is her area of expertise. So I'm going to open up the floor to you.
Yeah. Okay, so barriers. Transportation would probably be a big barrier for many, especially in the wintertime. So we, as resource specialists, we offer, there's a couple different ways that we can offer transportation. We can offer bus tokens. So you would just give us a call, call the resource line, and we would be happy to get you a bus token. We could mail it to you. We would also ask if you maybe had a friend or family member who could bring you to your appointment. We could give them a gas voucher. We have an agreement with the oh goodness, I can't think of the name of the gas station right now, the Marathon. And so we would give you a voucher, and you would take it there and get your gas that way for your family or friend. The health plans also have a log that you could get, or we could print one off for you. And each time you came to your medical appointment, you would just write down the date and how many miles that it took to get to your appointment. And then at the end of each month, you would mail that to your health plan, and they would reimburse you for the gas miles. I think that is the main. Am I missing any, Kim? I think that's mainly what we can offer there. There's also, we were talking about gym memberships, and we know that they can be a little pricey. So we did a little bit of research to see what was out there, and I found that the YMCA, they have a program. It's actually a scholarship. It's called the Open Doors Scholarship. So if you were to contact the Y, they could give you further information on that. But mainly there's a scholarship, and or they could work with you based on your income to give you a discount on a gym membership. And then there's other things that could get you motivated and moving. That would be like you could do YouTube videos. There are so many different options out there, anywhere from like 10 minutes to an hour. You could find different workouts, full body workouts, some other barriers. We talked about healthy food options. Aldi is a really great place to shop. It's very reasonably priced, fresh and clean foods. And then every Monday at 9 a.m., Grace Health offers a program called the Fresh Fruit and Vegetable Initiative. And it's across the street at the church. It's called Seventh-day Baptist Church. And Grace Health hands out fresh fruit and vegetables in a box, and they fill it with other good foods as well. So, yeah, so there's some barriers.
Yeah, I think that's really helpful.
Yeah.
Perfect. So then I just wanted to quick touch on, we've talked a lot about ways that you can kind of help yourself or make changes in your lifestyle to reduce your heart disease risk. So I did just want to briefly touch on the role of medications. I know we talked about statins, we talked about aspirin really quickly, but there is a role for medication as well to reduce heart disease risk, and even more importantly, if it is something that you've already been diagnosed with, or if you've had a heart attack or a stroke or have heart failure, medications can be really, really important in this as well. So I won't go into the details of them, but kind of like I had talked about with the cholesterol medication, those statins, and as I had alluded to earlier, I'm not one who likes to take medications either. So I absolutely feel for people when that medication list is getting long and we don't want to add anything else, and I get that. I like to try to keep the medications as minimal as possible, which is why I like to stress those lifestyle things as much as I can as well. But there's a lot of good data for the medications that we use for heart disease. So if this is something you've already been diagnosed with, there's a reason that we use these medications. It's because, again, we know that from very good data and very large studies that these medications can help you live longer and help you live healthier with less risk for hospitalizations and just not feeling good. So I did just want to touch on that, and again, obviously that's a very individualized thing that you and your provider would need to talk about, but I wanted to make note of the fact that, you know, we do have very good medications for this as well, if lifestyle factors are not enough, or if we've kind of already gone into the heart disease realm. And that doesn't make those lifestyle factors any less important, but it can just be a good augmentation or something to kind of help make those a little bit more effective for people. So I just want to open up the floor to any questions for myself or for Kari. You can throw those in the comments if you have any, and we'd be happy to answer them to the best of our ability. Okay, so we have a question that says, how often should someone see their doctor if they feel fine but have risk factors? So the minimum recommendation would be every 6 months. So, you know, especially if you've got high blood pressure as a risk factor or high cholesterol, at a minimum every 6 months or twice a year. You know, depending on how those things are looking, if you're really well controlled, if you're just kind of cruising and doing a good job with everything, then 6 months is usually quite adequate. But sometimes we need to be a little bit sooner, every 3 months or so, if we're trying to get things under control initially. Okay.
So this question says, can someone help me meal plan? That's a really good question. I would like someone to help me meal plan. Yes, there's definitely options there, depending on, you know, your diet and your special. If you have restrictions, we then would have to coordinate with the provider. But yeah, we could definitely help with that and guide and lead and educate. Mm-hmm.
Yeah, we do have Kirby, our dietitian, who I kind of mentioned earlier. So especially a lot of people with diabetes, we wind up having her see, but she does have availability virtually as well. And then we have our healthy lifestyle coaches too. So I don't know how much they do specifically with meal planning, but they could probably be of significant help there too.
We're happy to answer any other questions if you have any.
All right, and well, we got a couple more coming in. Okay, when my provider orders labs, when should I complete them? So it just kind of depends. It's usually helpful for us to have those labs done, you know, by the time that we see you at a visit, so we've got kind of up-to-date information to make decisions off of. We know transportation can be hard, kind of like we already talked about, so we understand, and really better late than never is also another way to go. But ideally, if you can have them done before your visit, if they've been ordered already. And typically when we're checking cholesterol, you know, ideally we like that to be a fasting lab. And data on that is rapidly changing as well. But for now, most people still prefer to have that fasting for it to be the most accurate. And then another question, what testing is available to assess heart health? So there's a variety of things, you know, it again depends on, you know, age and risk factors and different things like that. You know, typically we're gonna check in on your cholesterol, like we're gonna check your blood pressure, you know, those things that we can kind of do in the office fairly easily. If we start moving into symptoms or having other concerns, we can get EKGs in office to look at your heart rhythm and heart rate, or we can do stress testing. You know, we can do sometimes carotid ultrasounds if we're concerned about that, and there's certain risk factors. Lots of different things that are available, but they're kind of very specific to personal situation and risk factors.
There's another good question here. Is there help for people who cannot afford medications? Yes, absolutely. We have what's called a sliding fee discount program. Our outreach and enrollment, they handle that, but we could actually help guide you and educate you in how that plan works. But it is a very great program and at significant discounted rates.
So we'll give it another minute or so for questions, but I'll just kind of wrap up while we're seeing if there's anything else coming in. So again, I know we kind of touched on a lot of things pretty rapid fire here today, but just remember, we're all starting in different places in our health. We all have different goals and different barriers and different risk factors and all of those things. But the most important part is that we're making small improvements each day to try to get healthier and to feel better and to protect our hearts. So it's never too late to make changes to be healthier. I was reading into some data just the other night about that, and it definitely is there's never a point where these changes are not beneficial for you. So don't think that, I've already had a heart attack, it's not too late. To the contrary, it's even more important, that sort of thing. It's never too early, it's never too late, and it's worth it, definitely. Like we've kind of talked about, you'll feel better, you'll feel more in control of your health, and it will reduce your risk long term. So it can be helpful to get some accountability, get friends and family involved. Like I said, this is something that impacts all of us in some way, whether it's really personal or a little bit more remote. But that's our encouragement for you today.
Yes. So we do have another question. It says, what if I have insurance and my medication is very costly? Is there someone who can help me at Grace Health? With the sliding fee discount program, there is a lot of detail to that, and I won't get into that right now, but there's an umbrella of a certain income that you can bring in, and if you fall underneath, again, I won't go into the detail, but if we can't help you here at Grace Health, there are other programs in the community, one being Salvation Army. They have a great program, and they can offer some assistance there too. So reach out to us. I'm happy to talk to you more. Call the resource line and we can help educate you and give you some more information on that, okay?
Perfect. Well, thank you everyone for joining us today, and enjoy the rest of your day.
Yeah.